Your hair is falling out, but you don't know why. There could be a number of reasons. Here to help us get to the root of the problem and help you regrow your hair, please welcome board-certified dermatologist Dr. Rana Mays from the Dermatological Association of Texas. The hair is like other parts of the body. When things start to change, it's signifying that something's changing in your body most times. There's different reasons for losing hair, thinning hair, and what would those be?
Exactly, Deborah. So hair loss is a complex entity. You can have multiple causes, all the way from certain medications to stress to hormonal changes and, of course, to other underlying health conditions.
Yeah. And then, of course, other things can be just genetically male pattern baldness, which happens in women as well.
Right.
Okay.
So the most common cause of hair loss is androgenetic alopecia, or male or female pattern alopecia. It's the most common one that affects millions of Americans, and it really, the causes are not known, thought to be hereditary, but it's the one that we normally see with the bitemporal kind of receding hairline and thinning of the central scalp hair.
Yeah, and sometimes it happens in women two times. One, menopause, the other after having a baby. And women will say, my hair is just not the same.
Exactly. So yeah, again, coming back to different causes of hair loss. So the one after having a childbirth is called telogen effluvium, which is a different type of a hair loss, but female pattern or male pattern hair loss is extremely common, and that's the one that we normally see and thought to be hereditary or genetic predisposition to.
All right, there's all types of products out there, and there's always an infomercial saying, do you have one strand of hair? We'll give you a whole head and with just one shampoo, right? But what we're looking at here, platelet-rich plasma, or what they call PRP. What is that and how does that work?
That's correct. So PRP stands for exactly platelet-rich plasma. It's a highly concentrated extraction of the patient's own platelets, which is a special type of blood cells in the body.
Which the nice thing about that is that your body doesn't reject it.
Exactly. It's a very natural, if you will, treatment, and thought to be have wonderful tissue regenerative and healing properties. Actually, PRP has been used in medicine for over 20 years for joint disease, reconstructive surgery, and chronic wounds, but only recently we've noticed potentially the improvement and benefit in hair.
Yeah, okay, so and how is it doing that?
So PRP is, like we said, it's the aggregated platelets in the patient's, from the patient's own blood.
I feel like I'm going to medical school. I'm learning stuff right here.
And these aggregated platelets are important because once they are activated, they release certain biorestorative molecules such as cytokines, growth factors, and even stem cells that they recruit. And so once we inject them into the patient's scalp, then has those biorestorative and tissue regenerative properties for the hair follicle to stimulate hair growth and strength.
Yeah, so basically reinvigorating that hair follicle. It's not like it's going to give you extra hair, it's going to give you the hair that you lost.
Yes, it's for the best patients for this are people that are early in their hair loss, so you can regenerate those hair follicles as early as possible. You can be pretty aggressive with it. But, you know, PRP is now just being used in androgenetic alopecia. We would have to do further studies to see how beneficial it would be for other types of alopecia.
Now, is it something you have done one time, or is it several times, or do you have to go back like almost like a maintenance?
So treatment response can vary. Usually it's one treatment and followed with a booster treatment about 3 months, and then it can take up to 6 months to see the full results. However, you may need multiple treatments to get the results that you're really going for.
Okay, it makes sense that if it does that for hair, it probably does good things for skin.
Right, absolutely, Deborah. So the same properties, the tissue regenerative and biorestorative properties that we use to kind of stimulate the hair to grow and strengthen can also be used for skin rejuvenation, tightening, collagen synthesis, and changing the texture of the skin. So this is one of our patients.
And making it like it was.
Right, exactly.
And again, is this like a series of treatments that you would do for the skin?
Usually a series of treatments is required, but some patients get wonderful results just from one treatment, especially for the hair loss.
Yeah, all right, so you're my new best friend. And